So I worked as a nurse for a long time in the hospital. I noticed a lot in my experience. A lot of hospitalization occurred that probably could have been prevented with good primary care. I treated a lot of patients that had exacerbations of their heart failure, exacerbations of their COPD, unmanaged diabetes, lots of things like that, that if they had had good preventative primary care, managing their diabetes, understanding their COPD, then maybe they never would have had to be hospitalized in the first place. So rather than being on the back end trying to fix these issues and catch up, I really wanted to be on the front end to try and empower patients so that they never had to get to that point with their diseases. I think trust is the number one most important thing between a patient and a provider. I think if you aren't able to open up and share what's actually going on, then I can't really know how to help you either. But I think in order for my patients to trust me, I also have to trust them, right? And so for us to have that transparency and also for me to be vulnerable, I think it's important for me to, while still maintaining a level of professionality, being able to be vulnerable that these are all issues that everyone struggles with. And so it's not me coming from this point of view, but really us meeting head on to kind of talk about things. Well, I think one of the biggest things I'm a true advocate for is that your mental health can greatly impact your overall health. I think especially in this area, it's a really common issue, anxiety and depression. And there's still, even though there's been a lot of change and improvement in it, there still continues to be a lot of stigma when talking about mental health issues. So one of my favorite things to talk about with my patients is issues of anxiety and depression. People don't realize how much it can improve their quality of life to receive treatment, and that there's nothing wrong with receiving treatment. Those have been some of my best days at work, is when I have people coming in to follow up on taking their medication and they're like, I didn't know this is what other people felt like all the time. Like, I didn't know that I could feel this way. And I think if we can erase a lot of the negative emotions that come with taking medication for depression and anxiety, that a lot of people could really find a lot more joy, and it could help with a lot of their other health issues that they're having if they can work on their mental health. So my name is Sami Cook. I'm a family nurse practitioner, and please come and see us here at Utah Valley Family Medicine for any of your primary care needs.